Hello everyone and welcome to another episode of The Shientist and the Storm focus, introducing The Shientist science uh, uh, a science series, and this particular audio podcast will be focusing the Storm focus on this will be on science mechanism and evidencing faith. This is another Storm Logistics production, and as has been the case in previous segments, um, uh, I've broken down the audios or podcasts in three parts, where I provide a bit of an introduction, a bit of context around the crux, and joining the context with um, the main with the main introduction, and then an overall summary or summary, and then um, uh, as has been the case in the other audios and podcasts in this series, I have also provided some resources for further um, uh, um, reading and references that listeners can go ahead and look to identify these resources at their own leisures. At their own leisure. Um, so, uh, so I'm going to talk, as I mentioned, around um, uh, quite a quite a little bit of a sensitive topic in one way or another, but also hopefully quite uh, um, a welcomed overview on this subject. Again, this subject entity is around science mechanisms and evidencing faith. And before uh, highlighting anything or providing this overview, I want to uh, highlight that this podcast and audio is uh, not going to delve into too much of the context and areas around physics and metaphysics, um, mind-blowing orbitals or black holes, um, galaxies and Milky Ways, and those kinds of areas, or that kind of area of science. I know that there are experts um, who are well read in those disciplines, and so I'm not going to delve into any of that. This is going to be more again around this linking areas between science, um, uh, research, and healthcare, um, as has been the case throughout the series on the Shientist, or introducing the Shientist to date, and that is also to say that there will be a focus around long-term conditions, and I will also bring in the context around a specific long-term condition group, chronic kidney disease, and kidney care. Um, so to begin with, a bit of introduction. Um, the complex and nuanced nature of healthcare, and listeners would know that healthcare um, kind of um, uh, kind of comes out in various means different things to different people, but also has various focuses across different specialisms and between different healthcare sectors, and also means that those different areas of healthcare are perhaps more well funded, or funded in some regard more so than in others, and therein maybe some areas of disparities or healthcare inequity. So the complex and nuanced nature of healthcare for patients with long-term conditions can be challenging at the best of times. That notwithstanding, patients with different long-term conditions, including kidney disease, or chronic kidney disease, or even acute kidney injury, for example, may find it quite challenging to navigate aspects of healthcare, and there are some obvious, well, I say obvious quite loosely, but there are ongoing challenges. There are ongoing challenges, and some of them are more obvious than others. Work by Stewart in 2008 and Smith and his team in 2013 highlight different aspects around ongoing challenges, and even delve into aspects of healthcare and commissioning, or aspects of funding. And I'm not going to focus too much on that, at least not all the way through this audio or podcast. There are new models of funding or contracting, and such ways of identifying funding, or where service providers may have issues issues and concerns looking for or identifying funding. So service provision for different aspects of long-term condition groups can be more vibrant. Still remains to be perhaps one of the sort of ongoing problems, where there still is a lack of integration, and so that leads to that also means and leads to or it should lead to routes really where health professionals seek out more collaborations to bring areas of service and healthcare into the mainstream for health for healthcare for those who are perhaps challenged the most, and certainly routes for alliances and alliance contracting, for example, are worth identifying to understand if ways can offer patients an appropriate balance of choice of areas across and spheres of healthcare, so that there is again more interconnecting or interconnectivity and integrated care between different specialisms as well, especially when patients who have certain long-term conditions, for example, will not be foreign to the fact that they will see more than one health professional to address different aspects of their health and physiology, for example, over the course or life course of the challenges around their healthcare that are ahead of them. And then at the heart of this would be crafting of arrangements that ensure that providers or service providers can deliver best practice that is well coordinated and high quality, but also whilst avoiding the risk of monopoly provision that compromises patient choice. That context, listeners, you can gain more understanding by reading the works by Smith and that team in 2013, and also Petsoulis and that team in 2015. There's also there is some context around this in works by Mohammed et al. Mohammed and team in 2019 and 20, and more recently, and you are welcome to look that up, which focuses around the efforts around the Renal Patient Support Group, or the RPSG, and I will highlight a bit more of that since it is an area of expertise that links well into areas of healthcare research and healthcare science, and that's what these audios and podcasts are about. In present studies as well, there are focuses where there is an effort, or effort has been made in some way or form to actually link quite well, I would say, to to an extent where authors have focused to bring in understanding around areas of healthcare and faith. And in this context, I'm actually going to focus on the work on in areas around the Muslim faith, and that is Islam, or Muslims would refer to Islam as al-Islam, which means in translating that, or the Arabic is basically means in translation from Arabic to English, al-Islam means the faith. Now, studies by Dine and team in 2012 and Dine in 2013 highlight there is ever more a need to include those of different faiths, and there is apart from Dine and team 2012 and Dine in 2013, there are other authors who have looked to publish or highlight understanding around different faiths, but the context here will be to link the understanding around the Muslim faith, and that is also to say further that there is a need to include those from that particular faith in research, gathering perspectives really in context against different areas that there may well be retrospectively exclusion. And so without delving into too much around the sociology and even the theology, because that's not an area of expertise that is going to be highlighted through this audio, but more around a link between sciences from different aspects of healthcare, and so perspectives are needed from that faith, perhaps more now than in previous times, because there has been a test across various spheres of of health, wealth, and other and generally other aspects of health. General aspects of against different aspects of life, and so it also means that for different areas of healthcare, some aspects that apply from in the Muslim faith have not have been, for example, have been have been implemented or explored, perhaps loosely more than more formally, but without really exploring or understanding the basis of where those particular practices perhaps retrospectively have been documented over time from even the time of for example, the Prophet Muhammad, peace be upon him. Now, for example, where COVID-19 has been long-standing in areas across people's lives, at least over the last 18 months to 2 years, for example, and the practice around cleanliness, keeping distance, for example, as well, and having a face mask to stop droplets or the spread of what could relate to COVID-19. Those areas are also where, or those focuses are also where, where Muslims, for example, have actual expertise, owing to their practices, long-standing practices, in fact, around, for example, the focus around ablution or ablution from in translating English to Arabic, for example, ablution from their perspective would be referred to as wudu, and they practice that, for example, 5 times a day, in line with their prayers, which they refer to as salah, or sometimes namaz. Now, given that they have that expertise, and quite rightly so, that notwithstanding, that expertise hasn't really come out into the mainstream in line with aspects and guidances that relate to COVID-19 guidances, and also how the practice that they have, whilst it's been long-standing, there has been a good evidence base around aspects of how they practice and what they do to keep pure, and also and where cleanliness and being pure is concerned, that is not restricted to, or restrictive to physically cleansing, but also to aspects of the cleanliness of wealth, and as we all know, being having good wealth, or even good health, leads to good wealth, and vice versa. I believe there's a saying around that. Again, I'm not claiming to be an expert in anything related to putting an understanding on certain markers that relate to mnemonics, but in this context, we do know that owing to their expertise, that also means that their expertise around those areas of practices around faith wherein there are advantages and benefits that should be understood in line with how the pandemic has been apart from being burdensome and being restrictive, it has claimed lives in different ways, where healthcare is concerned. So there has been literature out there relating to aspects of the Muslim faith across different areas and focuses, and that is something the way that they practice could stand to benefit mainstream in lots of different ways, and gathering perspectives in context is important, and work by Abu Raya and Khalil in 2009 do delve into some of that, not so much around COVID-19 per se, but around other aspects of varying aspects of of healthcare. There is also an instant requirement for propagation of rudimentary understanding, a rudimentary understanding around certain bases around specific long-term condition groups. And again, I give the example of chronic kidney disease, and how health information or education, whether that has actually been made available in an appropriate manner for different faiths, but also wherein there are different faiths, that also means that there should be that there would be or should be specific areas of those different faiths that that are at least the good practices that these different faiths have come out also into the mainstream, but also where that also means that educational context should be made available in line with the Muslim faith as well. So where aspects around accessibility and accessibility and different aspects of healthcare are concerned, that has been highlighted and documented, or published in the works by Platinga and team in 2010, and Platinga in 2000 and that team in 2012, and Platinga in 2013. Now, Muslims and non-Muslims alike, like any other human beings and those who roam on earth, have obviously there are common aspects that they share, but also where healthcare is concerned, or aspects around healthcare, or where there may be areas of burden, for example, and where they may be tested or feel tested or feel stricken in some way, that then leaves or prompts them, to delve into using resources that they may not usually use. So, for example, we've all heard of, or I like to think that we've all heard of, the flight and fight response, for example, when there's something that is out there that that looks or appears, for example, frightening or terrifying, then we instantly we might feel like we have a gut feeling, for example, but as part of our instincts and responses, we have either we find ways to defend ourselves, or we find a way to become offensive, or go and find a way to, for example, launch launch an attack, so that we feel safe again. That might be a bit of a perhaps a raw way of saying, a raw way of actually saying, identifying ways to harness coping strategies, but it is through those particular challenges that when pushed or having to for example, being poked and prodded, for example, in areas across healthcare, for example, leads individuals to identify coping resources. And this could be because of several reasons or obstacles. And I'm going to again focus on give that perspective from those who are around the Muslim faith. Muslims may find it a challenge to discuss or access specific areas or health requirements that relate to, for example, today's medicine or Islamic doctrines. And this then comes down to how healthcare providers who look to be or provide areas around provide robustness around for example, diversity and inclusivity, that they also endeavor to house more faith-based services or practices. Only until such areas have been explored and potentially implemented that actually Muslims and non-Muslims alike, those going through long-term conditions, for example, and those who are also even without illnesses or ailment, actually can empathize with each other's with each other's circumstances. That is when actually there is a sense of togetherness and more commonality, and actually that can fill gaps in understanding, and prompt more awareness, and therefore there would be perhaps more equality versus disparity. This in turn would also help all to adopt, when there is togetherness, for example, and a sharing of understanding. This in turn would also help to adopt, help individuals through through challenging times, and where there might be those examples from the Muslim faith that they come out, or those examples come out, that would they could well not just be positive, but they could be strategies that could be adopted in times of challenge and hardship. And from that faith, and where cleansingness is concerned, and when sanitizing is concerned, or cleansingness, or as mentioned, the Arabic translation for that would be wudu, where they practice that as part of their 5 daily prayers, for example, and that as the perspective on social distancing, and the wearing of masks. Actually, when extrapolating the context and understanding, we can identify that is quite close to how Muslims versus non-Muslims have been used to, for example, being isolated, and it is with that, or at least with that in mind, there is actually more care and a sense of good practice in the time of the last 18 to 24 months, where COVID-19 is concerned, that actually relates very well, to an extent, with more around the Muslim faith versus the non-Muslim faith. But that being said, there needs to be more perspectives that come out from Muslims to help highlight or potentially compare and contrast that, so that actually those from non-Muslim faiths and other walks of life, for example, can learn from, and so that we can all learn from. So I now want to highlight some context around the linking some of that understanding with more areas, with some more aspects around the health, around healthcare. So I'm now going to talk a little bit about the crux, really, or the principle of bringing aspects of understanding around science mechanisms and evidencing faith. So if, for example, UK healthcare is to prove its wondrous nature or its elegance in future. Transparency transparency is important in between aspects of healthcare in across different spheres, and actually that also means where health professionals also have an understanding of the Muslim faith, for example. But in addition to that, there should be a way to encourage broader roles and against different healthcare professionals, so they are able to, for example, use untapped, use untapped knowledge base or skill set that they may not have opportunities to do so, and so that needs to be defined, and the remit needs to a remit in which that is being prompted. Those things or areas and focuses need to be measurable or need to be transferable and studies around that still need to be focused and explored. There is work by Shergold and Grant published in 2008 which look at look at aspects and focuses around transparency and different roles against different kinds of health professionals or healthcare professionals. As part of this, clinical commissioning groups and, for example, general practice, at least in the UK, and the NHS or the National Health Service and areas within it must be not just be transferable where aspects of roles, healthcare roles and professionalism is documented, and how that could be and how they could be explored, so that those health professional roles are, for example, more dynamic. But there must be there should be, or has to be a focus around patients, patients, individuals, and the general public. And again, Petsulas highlights a little bit, and Petsulas and team highlight a little bit around that in their work in 2015. A growing body of evidence underscores the importance of effective self-management of long-term conditions, and that was something that was documented by Epping, Jordan, and team in 2004. Though a little bit dated, still very it is a decent body of work there that Epping and Jordan had, and the team did. Patients who patients or individuals who are more, for example, activated in areas of healthcare, and again, Muslims and non-Muslims alike. That is, for example, that is who recognise that they have an important role in self-managing, and have the skill base or understanding or comprehension to be able to navigate aspects of healthcare. And I've talked a little bit about that in a previous audio or podcast, and listeners are welcome to check that out as well. In line with that as well is that having the skill base and the confidence, and a couple of examples might be, for example, where language and literacy are concerned. Those who are more, for example, encouraged to take ownership and lead, for example, will have better health outcomes, and that's been documented and evidenced by Hanamaka and team in 2008, and also there are relatable examples and understanding by Green and Hibbard in 2012. With effective support and education, evidence also shows that certain skills can be developed and strengthened even among those who might initially be less confident. And again, I would say, at least where faith is concerned, Muslims and non-Muslims alike, and even those who are initially less confident or less motivated, or have low levels of health literacy and language, even with again with effective support or a support network, that can get better or can get better, and there is opportunity to become more empowered, for example, over time. Now, principally, there is work by several authors. I will highlight a few of them at the end, towards the end of this. But there is some evidence, though it's not particularly strong, or at least it's not highlighted in modern in more at least in more retrospective literature. There is more work that needs to come out, or research needs to explore that, for example, is there advantages of reciting and reflecting on verses of the Muslim scripture, for example, the Quran, versus other resources that individuals might use to, for example, cope. There is some research that has been published by Mohammed in 2021, this year, and has been published in there's been a paper publication that was published in 2020, I think it is, where Mohammed also looks at coping and chronic coping with chronic illness, and using a chronic kidney disease example. And there's a poster presentation around that work, and this particular question in Mohammed's work. He does look to address that, but also in work where is published around perhaps a more sensitive topic around organ donation and transplantation, and around the ethics around that, and looking at the context around the Muslim faith. But that is a question that needs that also warrants and also invite. There should be an invitation, really, to collaborate to help answer that particular question by, for example, scholars, if not scholars, academics and researchers who may have long-standing expertise to look at that, and there does need to be a focus around healthcare in that context, to help answer that particular question, and whether, again, principally, whether reciting and reflecting on verses of the Muslim scripture, or the Quran, can be both comforting, and whether that can promote positive coping, for example. Academics and service providers also should endeavor really to include those from the Muslim faith in areas of, for example, policy making. So there is actually more number one, patient and public involvement, but also to emphasize where there is inclusivity and diversity, because they too, that is those from the Muslim faith versus the non-Muslim faith, are still actually quite a hard to reach population in that context. Further actually would be to support or prompt or encourage more faith-based services. So actually there is more equality generally in aspects of healthcare practice. This would form unity between Muslims and non-Muslims alike, unity as well as commonality, and that would also or should invite positive collaborations, and actually would be a more eloquent definition of progress in across different areas of healthcare, and again bring more perhaps more dare I say it, but I will. It will bring more love in the world, and that's where it's important to know that that can still be achieved. I now want to just draw this to a close with a brief summary. So from a research stance, studies are required again to recruit Muslims and non-Muslims, patients and healthy individuals, to better understand how faith and aspects of faith versus, for example, atheism can bring more positive collaborations, and again unity against different in exploring different aspects of healthcare. In addition, research is also required to understand again how reciting the Muslim scripture, perhaps as an intervention, for example, may benefit individuals from non-faith backgrounds. I now want to highlight a few publications that listeners are more than welcome to check out. There's a paper by Sheikh 2007 actually. This was published in the British Medical Journal, or BMJ, and this is titled "Should Muslims Have Faith-Based Health Services?" There was the paper around Plantinga and team in 2010 who look at awareness of chronic kidney disease among patients and providers. That was published in Advanced Chronic Kidney Disease, again 2010. There are a couple of papers by Koenig who does look at spirituality, and whilst the papers are very informative, they don't his works look at spirituality and well, at least one opinion is that it's more about spirituality than faith. So there's a paper in 2000, so it's quite a dated paper, but still quite a good read. That's a paper titled "Medicine and Religion" that was actually published in the New England Journal of Medicine. And then there's a paper by Koenig again in 2000, and he looks at psychology, neurology, and immunology, and that work is fully titled as psycho neuroimmunology and the faith factor, and that again was published in 2000. Mohammed also did publish work looking at transplantation, psychology, stress, and transplant rejection, for example, in 2006, and that's a book publication that listeners can look to identify. It is available, but our listeners can look to make inquiries, for example, through the Renal Patient Support Group or the RPSG. There's also a paper by Lazarus in 1992, again dated paper but still very intriguing. It's titled "Coping with Stress and Illness," and that was actually published in and around the World Health Organization, in a publication related to the World Health Organization. There's also a paper relating to stress, depression, and the activation of the immune system, and that was published by Leonard in 2000 in the Journal of Biology and Psychiatry. And then there is a paper in 2001 by Riddler and Schwarz titled "Developing Interventions for Chronically Ill Patients. Is Coping a Helpful Concept?" And that was published in Clinical Psychology, in a clinical psychology journal. And finally, really, apart from some of those papers that are authors that have been highlighted in and around this audio podcast, I will look to highlight some of those in future podcasts. So potentially at a later date. But this final paper is by Guilford and his and that team, dated in 2002. Again, a little bit dated, but still quite an important one. And they question, what does access to healthcare mean? And this was published in a health services research and policy journal, again in 2002. I would recommend that if people want to find out more about this particular topic, a good place would be to start potentially looking at Sheikh's paper in 2007. Again, that was titled, "Should Muslims Have Faith-Based Services?" Sounds a bit more like a tongue twister than a journal title, but listeners are more than welcome to check that out. And I want to say once again, thank you for listening. I hope that you've found this invigorating in your own way. And this was an audio podcast on science, mechanisms, and evidencing faith, and it's from the Ztorm focus, introducing the Shientist, and it's another Ztorm Libostics production. Thank you for listening.